As critical as I am regarding my own industry, the drug world serves a very important purpose when it comes to healthcare. We would not have had the extension of lifespan here in the West if it wasn't for drugs. It's not like I just got up the next morning and changed my entire career. That's not the case. It was a gradual progression because I needed to learn, understand, find the pain points, and then establish as a part of my skill set what is the value proposition that I can provide to be able to eventually make that transition. We all have this ability to go and critically think about things. You will find that niche that, damn, this is where I fit into it. Food addiction, carb, sugar addiction is very real. I would put it right up there with somebody having a cocaine addiction. We've migrated to this low-fat, high-carb diet, and that's not the way Mother Nature intended. And this might sound like a shock to you, but we as Americans are just a really, really unhealthy people. Like, I'm all for being number one, but not when it comes to like obesity.
Welcome back to this episode of Behind the Success. Today we are joined by Dr. Urban A. Kiernan. He is a biopharma researcher scientist, along with podcast host of the Decoding Health podcast. Thank you so much for sitting down and joining us today.
Well, thank you for inviting me. Really
we
excited.
We are excited to dive deep with you into your background and to how you got to where you are today, kind of learn the ins and outs and troubles and tribulations you've had to get you to where you are now. So why don't we start back with going back into how you got into the science department to begin with? Was that always an interest? How did we become
did you just
researcher?
as a little kid know that you were going to become a doctor or a scientist? Was that always the path?
Okay, so there are two halves to the whole. A lot of it is nepotism. So my dad had a master's degree in chemistry. And when I was little, he used to just bring me to the high school lab on Saturdays, and we would do experiments. Like, I would set things on fire. Like, it was fun, like getting to play with like a lot of chemicals that, to be honest with you, CPS would probably be involved in this day and age. I think I was 10 years old. I made my first bomb. I made my first bomb. The only thing my dad wouldn't let me do was make my own detonators because he's known too many people who've blown their fingers off with that. But I got to make everything else. I could make my own wicks. And then on the second half was my mom's side. And so my mom was Filipino, and you were just raised that you're going to be a doctor. And that's the whole thing. Original course path is I wanted to become a surgeon, but that didn't pan out because, God has unique plans for all of us. And so on my mom's deathbed, when I was 24 years old, I promised her that following fall I would be in a doctorate program. And so I went the route of Ph.D.
So you are at the intersection of science, health, and business. And what are you the most determined right now to solve?
It's health, to be honest with you. And so not only through my company, iMetabolic Biopharma, but also through my personal endeavors. I don't know, this might sound like a shock to you, but we as Americans are just a really, really unhealthy people. Like, I'm all for being number one, but not when it comes to like obesity. Like, seriously, 50% of Americans suffer from pre-diabetes. That's bad. 75% of Americans are either overweight or obese. 93% of Americans have some sort of metabolic dysfunction. Any way you look at it, if that would have been a grade in school, my mom would have kicked my ass. Like, I still wouldn't be able to, at 52, I still wouldn't be able to sit down from the beating she would have given me. Yes, CPS get involved. It was a different time back then. But nonetheless,
Didn't you grow up in Canada, though?
I did.
So,
I did. Please don't say that. I was an American growing up in Canada. So, this is my home and native land, the United States of America. But nonetheless.
Quick question while I'm talking about Canada and thinking about it. Are they as fat as we are?
I would say yes.
Okay.
Yes. It's.
I didn't know if people you switch borders and drastically people are healthier in Canada, or if it's kind of the same thing for all of North America.
So I would compare the majority of Canada more like the Midwest here in the United States. So there's a lot of obesity, a lot of bad habits, including alcoholism. I will throw that out there. It's because of the climate. There's nothing to do up there during the winter months. It's like god awful. And so
You're
yeah,
cold.
you're cold. You just sit there and you drink. Like, yeah, I started going to the bar when I was 14.
Oh my gosh.
When I was 14 years old, so it's just like it's a different world, different culture. Nobody really, well, I can't comment now.
Right.
It's a different country now. When I grew up and when I was there, it was just like nobody cared.
Yeah.
As long as you didn't get into too much trouble.
So it's safe to say a lot of the things that ail America are also ailing Canada.
Yes,
When it comes to health.
as well as like the UK. There's a lot of similarities, a lot of trends because of the overlapping cultures there.
Okay. That's sad.
It is. It's really sad.
Not that I want us to be number one. Obviously, I don't.
That's the category I'd like to not be number one and come in last.
Yes.
So what do you think is one health truth that the public is being sold right now that you think is oversimplified or just straight up wrong?
That's a loaded question. There's a lot there.
I know there's a lot.
I don't want this episode to get shadow banned. So I'm going to go with the sugar answer.
Okay.
We are grossly over sugared. I could talk about some medications, but then the algorithms will crush us. So I'm going to say sugar. Americans are addicted to it. Food addiction, sugar addiction is very real. I would put it right up there with somebody having a cocaine addiction. And that's just not me. There are studies that are showing that. And so we as a people need to start not getting like Ph.D. level regarding the science, but understanding what the overall physiological effect it has, because the very percentage problems I was showing with you all relates to the simple fact that we've migrated to this low-fat, high-carb diet, and that's not the way Mother Nature intended.
I'm just so intrigued.
Question.
So within everything you're doing, what was a good light bulb moment that made you decide biopharma was the realm you wanted to be in and helping use, I don't want to say prescriptions, but yes, to aid in the better good of people's health?
And no, you can say prescriptions. Like as critical as I am regarding my own industry, the drug world serves a very important purpose when it comes to healthcare. We would not have had the extension of lifespan here in the West if it wasn't for drugs, like antibiotics. Now, I started off my career in the biomarker space, and early detection for disease is absolutely important, but I have to turn the clock back to 2006 with my first wife having cancer and sitting there and that whole just literally watching her dying in an ICU and sitting there working, writing a manuscript. Like I can feel being in that room right now as we talk about it, and just this overwhelming feeling of helplessness and having a sort of come to Jesus moment. It's like I've got this up and growing career. I'm doing well for myself. People are getting to know me as this biomarker guru. Biomarkers leading to early stage diagnostics, new technology supporting all of that. But unless it leads to a decision tree, like what's the point of it? It's a data point for the sake of generating a data point. And that's when my mindset started to change. Now, it's not like I just got up the next morning and changed my entire career. That's not the case. It was a gradual progression because I needed to learn, understand, find the pain points, and then establish as a part of my skill set what is the value proposition that I can provide to be able to eventually make that transition. And that took well over a decade to turn around and achieve. So, if there's anybody watching this that wants to go and develop themselves, you guys need a little bit of patience in order to do this. This crap doesn't happen overnight. You really need to immerse yourself, study in the background. And it's not like necessarily like, buying, Biopharma for dummies or something like that. It's just understanding, interacting with people, asking questions, and learning. And if you apply your brain, and we all have this ability to go and critically think about things, Whether or not you choose to do it or
Sure.
not, that's a different question. Critically question on things, you will find that niche that, damn, this is where I fit into it. And that's, where what I've discovered over that period of time, since that 2006, that experience, and wow, this sucks, and then just kind of growing from there.
You had mentioned faith, but faith isn't always something you would necessarily associate within the science realm. So how do you feel like your faith has helped you within your science industry? Do you feel like it's helped? Has it done it in any way, shape, or form?
Or does
helped
it
with
conflict sometimes, science and...
what you believe in and what you need to do, or what you're trying to achieve pharmaceutically?
No. And this is a great question, and we could go deep on this. Like,
and I know it's loaded in a lot of ways.
No, it's like, if we had some Mary Jane right now, we could go around and just turn this into a Joe Rogan experience. But nonetheless, in my study of science, it has absolutely, unequivocally shown me that there is a God. Now, whether or not you believe in the Christian God or anything else, some sort of creator or anything, that's up to you, for you guys to decide. But to me, there is unequivocally a God out there. And then I've got my personal views and faith. And, that's one thing that's very up there. But nonetheless, in terms of my personal faith and how it helps me on a daily basis is, you go out through your day and shit happens. Okay? And there's a lot of people, they just fixate on the negative. And then there's other people, they just sit there and perpetually blow themselves. And it's just like, they just think about the positive. My faith sits down and is able to say, God is really interesting, and he does everything for a reason. Now, I talked about 2006. Okay? That sucked. But there was a reason why God did that. Because God wanted me to be sitting here at this point in time, sitting with you guys. And if that painful thing didn't happen, I wouldn't have this story to tell. I wouldn't have made that change. I just would have went on that career and just kind of went on into my own little unique set of the annals of scientific history, which, to be honest with you, really doesn't mean a whole heck of a lot. Like, how many scientists can you guys name?
Bill Nye, the science guy.
He's not a scientist.
But he's the first one that comes to your brain.
Sure. But he's a TV entertainer, and actual scientists. It's just they have to go and do something to make themselves pop out. They can't stay within the scientific community in order to have any meaningful relevance to every single day world. Like, you're holding your iPhone right there. Mm-hmm. There are thousands of scientists, thousands of patents that support that piece of technology right there, that if we would have went back to the 1980s, CIA would have killed you for that technology right there. Yeah. Okay, that you're holding it right in your hands. There are so many scientists that went into making that happen that nobody can name anybody. Yeah, that was evolved.
That makes sense.
Of that, all is about Steve Jobs. Steve Jobs did this.
Right.
But it was an entire team of gurus and miniature Steve Jobs to make it real.
Absolutely.
That makes sense. So do you think innovation in health is easier or harder today than it was 10 or 20 years ago, and why?
Sorry for not giving you a very descriptive answer. I'm going to just say it's different than what it is now. And a part of it is, I always refer to the drug industry a lot like Hollywood. So you have the
bad.
You have the Hollywood
positive about that.
Well, you have the Hollywood blockbusters that come out, but then every single studio is essentially doing a rendition of the same movie. Mm-hmm. It's just there's an asteroid going to hit the Earth. Well, no, this one's a comet. There's no difference between the general concept, and it's because there is a lack of ideas. And it's not that people aren't genuinely creative. It's just the business climate, because there is business behind science. And I talk about this on the show. Mm-hmm. There is so much money required now in order to get a drug to approval. Okay, so average timeline is 7 to 10 years. Okay, everybody be patient. Average cost, $1 billion to get a drug to marketplace. Okay?
Just one drug.
Just one drug to marketplace. But then you go and you look at the opportunity cost. So if they would have taken that $1 billion instead and invested into just U.S. Treasuries instead, the opportunity cost for that $1 billion is actually $2 billion. Okay, so how do you come up with something that doesn't necessarily just help people, but helps people, and we can recoup this cost and make some profit on this? And this is something that now, where we sit in this day and age and all the social media stuff, and we're all guilty of this, and news spreading and information and disinformation, and I'm not picking sides regarding what is which. I think in reality, the truth is somewhere in the gray in the middle between the two. It's really hard to turn around and position all this stuff. And in order to go and get that niche, in order to achieve these goals of businesses, they have to go to a lot of I'm going to call it scientifically sexy approaches for therapeutics. And scientifically, man, that's freaking cool. Would I take that? Hell no. But, it's coming up with novel technologies in which they can genuinely justify reimbursements that are well over $100,000 per year per patient for a particular disease. Like a lot of the new drugs right now, like especially in my space, we're seeing average cost per patient is $425,000 per year.
That's crazy.
That's a lot of money.
But again, there's pros and cons to all this. They have to cover the costs of manufacturing these things, and it's expensive.
The smartest entrepreneurs don't just create businesses, they create content that scales them. At PS Studios, we work with high-level entrepreneurs and creators across the country. Some fly in every month to shoot with us in sunny Scottsdale. Others send us their raw footage and we turn it into scroll-stopping, authority-building content. From filming to editing to distribution, we handle it all. Done for you. Turnkey content that grows your audience, elevates your brand, and keeps you top of mind. Leaders don't wait, they create. Schedule your call today.
So I have a friend in Europe, and she works in pharmaceutical advertising and the ads run in America. She says we're the only country that allows pharmaceutical ads to run. And it's funny because we've been watching a show on Hulu, and we have the basic Hulu, so we have all these ads every 2 seconds. And the only thing they advertise are different pharmaceuticals. Mm-hmm. So that in itself, has got to cost a fortune. But do you have any idea? Because to me, I'm watching this stupid ad for something that I don't have. Do they really help drive people to go to their doctor and say, hey, Dr. Urban, I really need this
Unicity or...
No, that's a supplement. But like, there's one for really itchy, nasty skin. And on the commercial, this person's like basically ripping their skin off. And
for
it is
psoriasis.
The grossest thing ever.
Yeah.
But does a commercial then lead? Is there good studies on that? Do you know, to someone being like, hey, go and give me this drug that I saw on the television?
So I can't talk about like any specifics regarding like that marketing data. That's for a different person's desk. It must work in order for that level of consumer education to take place. Because that's hundreds of $1 million a year.
Yeah.
That you have to throw just for a given drug to go and do that. So there has to be some sort of uptick in sales that they see with all of that. To
justify spending all that time and money.
Now, personally, I think it's the dumbest idea ever. Like, you really think that if you got a good physician, that they wouldn't be aware of the appropriate best solutions for you? But remember how I just said that there's this... It's kind of like Hollywood. A lot of the same things that are coming out now, they're vying for market share. 1% here, 2% there. That's a lot of money that adds up very, very quickly.
So like Ozempic versus is it Wegovy is the other one? Or is that the same thing?
So
Semaglutide versus Wegovy.
Well, that's the same drug you're talking about, like the Zepbound versus
Zepbound.
Wegovy.
Okay, yeah. So that's like a good example of we do basically the same thing a little differently, but we're both competing for that same exact
space.
market share.
Yeah.
Okay.
So again, if we can go and capture 1% of that market share just by running this ad, that just paid for everything, right there. Again, I already, my own personal standpoint, that's I think it's dumb, but nonetheless, there is business aspects to it. Again, that's somebody else's desk that you have to contend with. I am going to let my conspiracy hat down with that. I think there is an aspect of this because we do live in such a litigious society, and word travels so fast that personal belief, if you can control the media, you can control the world. You control the narrative. And this is something that if you are paying these networks hundreds of millions of dollars a year for these drug sponsorships, and if we F up, and that happens mistakes are made all the time, you can quash that news coming out. Because guess what? If you run this news or you continue on with the story, we're pulling our ads.
Yeah, and then there goes the entire station.
Yes.
Yeah.
So
That's
again,
scary.
No,
Yeah,
it is really scary, but I think that there is that business aspect in which, you are dumping so much money into this system, you actually have a say.
But maybe that's why Europe doesn't let people do it.
They're on to something over there.
You also have to remember too, Europe, they've also got a single payer system.
Okay.
And, having grown up in Canada, it's like litigating the healthcare system. Good luck.
Got it.
Good luck. Whereas here in the United States, you just get yourself a good attorney. They'll start punching holes, get the anti-lawyer on the case, and then they'll start just punching holes into everything, and they'll wind up with a settlement. Like I actually did that episode regarding the class action lawsuit regarding Ozempic and stuff, and my personal thoughts on how the defense is going to turn around and handle this case on the whole thing. It's a very, very real situation. You see ads on the TV all the time. Have you been hurt by this?
Yeah.
Call us. We've got a class action lawsuit. You don't see those over in Europe. Class action lawsuit. What is that?
Yeah, I guess that makes sense.
Yeah.
Never thought about it that way.
I know. I never did either.
And when you're over there, you're not there for medical purposes anyway.
skiing.
So that's like the least of your concerns.
Yeah, I know. When I'm in Europe, I'm around all the most fit people on the planet. Like, you do not see fat people skiing. You just don't. It's way too difficult, I think, to be overweight. You might be metabolically unhealthy, but in terms of like
you're not a heifer going down the mountain.
Your body weight, you figured something out to be able to.
Would that actually be skiing, or would that look like more like bowling?
I feel like it'd be rolling down the mountain. Like, they don't allow sledding at the resorts I go to.
Yeah.
But yeah, so I feel like I don't have a good grasp on
but you do
what's going on, and I've never turned a TV on in Europe, so I guess that's another thing too. I don't even know what they advertise. I know they can't do pharma because my friend works in pharma advertising in Europe for the U.S.
But again, you're busy doing other activities, while you're over there. And again, too, the obesity issue, like what we already talked about, I specifically said the UK. Central Europe doesn't have that same issue.
It's fascinating. You know what? I do remember they have little pharmacies everywhere. And when I was skiing in France last year, there's like a pharmacy every other corner.
Yeah.
And they were advertising that you could buy the weight loss drugs there.
Yes.
So, I mean, I guess the craze is global when it comes to a lot of the most popular drugs, wouldn't you say?
Yes, but the majority of the money is made off of that. That's clear, off of Americans. Yes. Yeah.
Crazy.
Well, that's an unfortunate stat.
Okay, so we know that that's a peptide you do not like. What are your top 3 peptides that you do actually like? I know you've talked about them on your show, and I want to lead people to your show.
Oh boy. I really don't like to disclose personally what I do because it's not medical advice. This is just purely for entertainment. Just simply because I'm 52 years old. You know, I've had surgeries, it's just the aches and pains and everything. I am a big proponent of VPC 157, TB 500, the GHK-CU.
Okay, I'm talking to my doctor later for the GHK-CU because I heard it makes your skin like age in reverse and that I might not need Botox if I do it. What are your thoughts on that?
Well, I've done an episode on that, and yeah, it does help with collagen healing. The anestheticians had a hard time saying that word during the episode.
Esthetician?
Estheticians, but yeah, it is actually a big. It's used transdermally quite a bit, for treating.
Okay, so maybe I can get rid of the scar across my nose. It's still there.
It is. Well,
Yeah.
I just give it time. Be patient. Patience,
I
everyone.
just want a peptide to solve my problems.
Yeah, but so I'm a big proponent of that.
Okay.
It's just because that's all for healing and recovery. I do have to throw this out there because now that I'm on TikTok,
Woo!
yeah,
He's so hip. He's so cool.
He's with the program, people.
they're the peptide people out there. They're what's wrong with you guys? Like, seriously, I have to throw that out there. There is so much abuse of research use only, the RUO stuff out there. It's like
Everyone on TikTok is on retatrutide.
It's
I can't
actually
say it.
it's pronounced retatrutide, not retatrutide. I'm so sorry.
Well, everyone on TikTok calls it retatrutide.
Yeah, because
Okay,
they,
everything you need to know.
Reliable source.
because the only way you can get that is using experimental compounds that are not meant for human use. And so I have to throw that out there. It's just like you're playing a game of Russian roulette. I'm not surprised that you cannot pronounce it correctly. Okay. And then I get chastised because, I hate the way you say it. Okay. Is that your biggest argument that you can have with me is you don't like the way I pronounce it? I also
funny.
say process and progress too, fellow Americans, because I grew up in the British Commonwealth and that's the way everybody says that up there. So, I just got to kind of throw that out there. If you are going to take a peptide, again, I'm very libertarian with this. Go and do what you're going to do. If you're going to use RUO, fine. That's totally up to you. If your dick turns black and falls off, I told you so.
It's up to you too, I guess.
That's
You
totally
made
up
that
to
choice.
you. There are compounding pharmacies that make legitimate compounds with some level of safety oversight regarding what's going on. And so I just want to throw that out there because I've got gripes with the FDA. I agree with some stuff. I disagree with other things. However, I am not going to go and concede when it comes to safety.
Right.
Plain and simple.
That's super fair. So when it does come to looking at health products, how could you help consumers evaluate claims without having a PhD background? So if they were to go look at the store and compare a couple things and decide I want option A over B, is there a couple key factors that they should pay attention to, whether it's ingredient placement, key phrasing, or words you don't want to see?
Or like say somebody is at the store and they're like, should I buy Tylenol or should I buy Aleve? Right?
Right.
They're all marketed to do the same kinds of things. And I
Right.
didn't know Tylenol was bad until, wasn't there the whole, the press about Tylenol and then Trump came out and said something about Tylenol and now everybody's talking about it. But
So-
I've been taking Tylenol my whole life.
And I can only take Tylenol because I'm allergic to NSAIDs. It's just like, I don't know if anybody notices. I have to wear this because if something happens to me and they think I'm having a heart attack and I'm unconscious, the first thing they're going to do is hit me up with aspirin.
And that'll kill you.
Oh, hell yeah. So I have to wear that just because, no, we have to wait till he gets to the hospital and we'll hit him up with heparin. Okay, so yeah, I can't, the only thing I can take is Tylenol. This is a mountain out of a molehill. Again, done an episode on this. The Johnson & Johnson, the manufacturers of Tylenol, have said since day one, do not take this while you're pregnant.
Yeah.
You don't take this while you're
You
pregnant.
don't take anything while you're pregnant. You
You-
just
you really-
suffer and be pregnant.
Yeah, suffer and be pregnant. Again, it's your choice to be
Yes.
pregnant, but nonetheless, it's just those, even if you're type 1 diabetic and you take insulin, that will cross the placental barrier, and you are dosing with baby with insulin. Do you not think that that has a consequence? So you just got to kind of weigh out the risk to reward. I cannot talk about specific products because there's just so many of them out there.
Right.
I am going to throw it out there. Supplements are not regulated. Okay, people need to understand that.
None of them are.
None of them. And that is something where it is literally the Wild West. And there are so many knockoffs out there. Even Amazon is getting hit with that.
I've heard that it's the worst place to buy them from.
Well, because they can't guarantee that because when they run out, they go to these mom and pop shops, and a lot of these are fake products from other countries. It looks very similar, but you have to look at the label and it's like, this isn't quite the same, and there's no way of being able to stop that. So you don't actually even know what's in that. The only thing that I will suggest, if you're going to decide to do something, only take one thing to improve your health. Okay. Only do one thing at one time. Don't change 5 things at once, because
then you won't know what worked, right?
Exactly.
Well, you won't even have a little bit of an inkling what worked, because there's so many other factors in play too. Say you start taking vitamin D, but then you also, I don't know, went golfing that week and got more vitamin D. Like, there's so many things that will help that number go up.
Agreed. But like, human behavior wise, you can't turn around and control that, at least as a part of your daily regimen. Only make one change at the exact same time. Now, regarding what it is that you're trying to implement, the 3 things that I look for on the label is it's made in the United States. Okay. And you have to take that with a grain of salt. Number 2, it's GMP, good manufacturing practices. It follows that. And then number 3 is it's third-party tested.
Okay.
And all of those are on the labeling, packaging somewhere?
They're supposed to be.
Okay.
Okay. So all of the stuff that I wind up going with, that's what I do. That doesn't mean that product's going to work. So I just did an episode on urolithin A, and I just did 90 days of urolithin A, and
none of us know what that means. What is that?
Urolithin A, it's a compound that's produced by your gut microbiome to help your body produce muscle.
Okay.
Like, so Dr.
So
Gabriel.
do you feel like you're way more ripped now? How'd your DEXA go?
Oh, my DEXA is fine, but that's.
You don't have fat organs?
I lost 50% of my visceral fat.
That's amazing.
It is amazing.
I can't believe you even had fat. I've never seen you fat ever.
Well, no, it's just I carry it very, very well. But and again, DEXA scan from a fat percentage, it's a higher number than if you did caliper testing. I went from 19% body fat to 13% body fat, and I lost 50% of my visceral body fat. And for the record, visceral body fat is the shit that's going to kill you.
So that's with the urethral A.
Well, no, urolithin A is produced by your gut microbiome. It goes into your bloodstream, but it helps stimulate your muscles so you can build more muscle. If you guys know who Dr. Gabriel Lyon is, she's big on urolithin A. Her product is $120 a month. The cheapest stuff I did go and find appropriate with the 3 things on the label, highly rated products off of Amazon. Again, it was still expensive. It was like $60 a bottle to go and do that. But
what was that supply, like a month?
It's $60 is 1 month. So I'll always give something 90 days to see if I feel anything from it. And I personally got absolutely nothing on that. Not to turn around and take a dump on urolithin A, but nonetheless, it's just one of those things. There's a lot of hype. A lot of social media people are like on this. They've got spokespeople. Turn around and do this. Try it out in isolation by itself and determine, is this working for me or not? Because I don't know, $120 a month, that's $1,500 a year.
That's a pretty solid investment in yourself.
Yeah. You need to make sure it freaking works.
Right.
Absolutely.
Yeah.
We had someone come in recently. He was a guest on Dr. Amy Shaw, who's a big time nutritionist, and I believe doctor as well. She, I don't know the backstory on the guy. I wasn't here that day, but he's the founder of PHI.Health. And what they've done is they've created a little capsule thing that you take in the morning and then one at night. And they're these tiny little micro beads. And apparently your body can digest and break those down way more than like taking all the horse pills that you need to have like the right supplements for longevity. That's kind of their whole purpose. So you take it with water every morning and then you take one in the evening. And so they gave all of our team this 30-day supply of it, which was amazing. And I've been doing it and I stopped everything else that I'd be able to test and see, hey, is this effective or not? But it's made all of our dreams across the board at the office like way more vivid. But I mean, does that really help longevity? I don't know. But that's like the only thing that I think all of us have noticed is our dreams are like way more intense. Do you have any insights as to what supplements kind of create that effect?
For intense dreams?
Yeah.
A big one is the mushroom lion's mane.
Okay.
And I personally go and do that. Again, I use a product that meets all three of those criteria. And vivid dreams. And that actually comes with brain healing. You know?
So that's good.
Yeah, absolutely.
Uh-oh. What does it say about if you don't dream?
Yeah, what's the opposite? Does that mean your brain is not healing?
Is my brain dead?
Again, we don't know what we don't know. There's so much behind all of that. Again, sleep is so important for the lymphatic system, brain healing, the whole 9 yards. If it's working for you, and the simple fact that you're having vivid dreams, that shows it's doing something.
It's doing something. Maybe
not exactly everything that they're stating. I'm not familiar with that product, so I can't give any particular insight on that. It's probably using the liposomes in order to. Yeah, I'm just speculating from what you said, the little beads, but like the liposomes for better absorption. But
yeah, fascinating. Okay, curious. I always like to get a biopharma viewpoint on random stuff, especially when it comes to supplements. Well, Dr. Urban, you have a very, very popular podcast. Tell everybody where they can find you, tune in, and subscribe and get to know you better.
Well, we're on all streaming channels, but our biggest one is YouTube. It's the Decoding Health. Actually, it's easier to find the podcast if you just search my name, Urban Kiernan. I'm the only one that's on there. Other people have tried to use the Decoding Health name historically, and you'll see some. It just doesn't look like him. No, it's not me.
He's in a white lab coat.
Yeah. But nonetheless, that's where you can find us. We are on social media on TikTok. It's the Decoding Health. My handle on Instagram is Lightbearer, Light. And then on Facebook, it's Decoding Health as well.
Amazing. All right, everybody, go give our wonderful client, Urban, here a follow. And thank you for joining us for this episode of Behind the Success.